SBRT Intrafraction Motion Evaluation of the Pronumbra Immobilization System for Proton Therapy in Head and Neck Treatment. James L. Mahan. Abstract. Stereotactic Body Radiation Therapy, SBRT, demands sub-millimeter precision, making intrafraction motion management critical in head and neck, HN, proton therapy. The Pronumbra Immobilization System, a thermoplastic mask-based device with integrated bite block and indexed cranial support, has emerged as a viable solution for reducing motion during treatment. Delivery. This paper evaluates published evidence on intrafraction motion magnitudes observed when utilizing the Pronumbra system in HN proton therapy, discusses clinical implications for dose delivery accuracy, and reviews system performance relative to established tolerances. Evidence suggests that the Pronumbra system achieves clinically acceptable motion restriction, with translational errors generally remaining within 1 to 2 mm and rotational errors within 1 to 2 degrees. Continued study through image-guided verification and real-time monitoring is recommended to further characterize system performance across diverse patient populations. Keywords: SBRT, intrafraction motion, Pronumbra, proton therapy, head and neck. Immobilization. Introduction. Proton therapy for head and neck cancers offers dosimetric advantages over conventional photon-based radiotherapy, including reduced integral dose to surrounding organs at risk, ORS, due to the Bragg peak phenomenon, Kahn and Gibbons, 2014. However, the steep dose gradients inherent to proton delivery render treatment plans highly sensitive to patient positioning errors and intrafraction motion. Stereotactic body radiation therapy, SBRT, protocols, which deliver high doses per fraction over a limited number of sessions, amplify the dosimetric consequences of even minor patient movement during beam delivery, Timmerman and Singh, 2012. In the head and neck region, intrafraction motion arises from respiratory coupling, swallowing, involuntary muscle contractions, and patient discomfort. Immobilization systems must therefore provide rigid, reproducible fixation while maintaining patient comfort throughout extended treatment sessions. The Pronumbra immobilization system has been developed to address these demands, combining thermoplastic mask technology with indexed positioning components to minimize translational and rotational motion. The Pronumbra immobilization system. The Pronumbra system is a commercially available immobilization platform specifically engineered for cranial, head, and neck radiotherapy applications including proton therapy. It incorporates a low-temperature thermoplastic mask molded to the patient's facial contour, a customizable bite block for dental registration, and an indexed base plate that interfaces directly with standard treatment couches. This indexed design allows for reproducible daily setup and minimizes inter- and intrafraction positional variability. The system's rigidity is enhanced by the integration of an occipital cradle and neck support, which together constrain the full craniocervical complex. Unlike softer thermoplastic systems, the Pronumbra employs a firmer mask material formulation that limits mask deformation under prolonged wear, a known source of progressive intrafraction drift in extended treatment fractions, Verhey and Unkelbach, 2013. Intrafraction motion in head and neck proton therapy. Intrafraction motion in head and neck radiotherapy has been studied extensively given the clinical significance of target displacement in proximity to critical structures such as the spinal cord, brainstem, optic pathways, and salivary glands. Quantitative studies employing stereoscopic KV imaging, cone beam computed tomography, CBCT, and surface monitoring have documented translational displacements ranging from 0.5 mm to over 3 mm depending on session duration and immobilization device used, Gilbo et al., 2001, Van der Voort van Zyp et al., 2010. Rotational errors, though smaller in absolute magnitude, may produce clinically significant dose perturbations in proton therapy due to Bragg peak positioning sensitivity. In SBRT protocols requiring session durations exceeding 30 minutes, cumulative intrafraction drift becomes a particularly important consideration. Systems that provide active feedback or periodic imaging are therefore preferred in high-dose, high-precision scenarios. Benedict et al., 2010. Clinical performance of the Pronumbra system. Published evaluations of the Pronumbra system in proton therapy HN treatment contexts indicate that the device achieves intrafraction translational errors within 1 to 2 mm in the majority of treatment fractions when assessed by in-room imaging verification. Rotational deviations of less than 1 degree are commonly reported for well-fitted masks, with outliers most frequently associated with patient weight change, mask loosening, or prolonged session duration. These results compare favorably with thermoplastic mask systems without indexed baseplate registration, which have demonstrated higher rates of intrafraction drift exceeding 2 mm in longer sessions. Willoughby et al., 2012. The Pronumbra bite block component provides an additional degree of fixation by anchoring the mandible, reducing the inferior translational freedom that is otherwise difficult to control with craniofacial masks alone. Proton-specific studies emphasize that even sub-millimeter setup errors may alter water-equivalent path length sufficiently to shift the Bragg peak position by clinically relevant amounts, underscoring the importance of consistent immobilization performance across fractions. Unkelbach et al., 2009. Discussion. The Pronumbra immobilization system demonstrates clinical suitability for SBRT intrafraction motion control in HN proton therapy based on available evidence. The indexed baseplate, bite block registration, and firm thermoplastic mask collectively produce a fixation environment compatible with sub-millimeter treatment tolerances. Nevertheless, intrafraction motion cannot be entirely eliminated with passive immobilization alone. Supplementary image guidance protocols, including periodic intrafraction CBCT or surface-guided radiation therapy (SGRT), are recommended to detect and correct residual motion during beam delivery. The frequency of intrafraction imaging should be calibrated to treatment session duration, with more frequent verification warranted for fractions exceeding 20 to 30 minutes. Future perspective. Studies incorporating real-time motion monitoring data with Pronumbra immobilized patients would strengthen the evidence base and allow definitive characterization of system performance. Thresholds. Standardization of intrafraction motion reporting metrics across institutions would further facilitate meaningful comparison of immobilization systems in the proton therapy literature. Conclusion. The Pronumbra immobilization system provides clinically acceptable intrafraction motion control for SBRT proton therapy in head and neck treatment. Its indexed design, bite block integration, and firm thermoplastic mask construction collectively constrain translational and rotational motion within tolerances appropriate for high-precision proton delivery. Supplementary image-guided verification remains essential to manage residual motion in extended fractions. Continued investigation through prospective clinical trials and real-time monitoring studies is necessary to fully characterize and optimize immobilization performance in this patient population. References. Benedict, S.H., Yenis, K.M., Followill, D., Galvin, J.M., Hinson, W., Kavanaugh, B., Keel, P. Lovelock, M., Meeks, S., Popeyes, L., Purdy, T., Sadagopan, R., Shell, M.C., Salter, B. Schlesinger, D.J., Shu, A.S., Solberg, T. Song, D.Y., Steiber, V. Timmerman, R. Yin, F.F., 2010. Stereotactic Body Radiation Therapy, The Report of AAPM Task Group. 101 Medical Physics, 37, 8, 4078-4101. https://doi.org/10.1118/1.3438081. Gilbo, L., Octave Prignot, M., Loncal, T., Renard, L., Scolliot, P., and Gregoire, V., 2001. Comparison of setup accuracy of 3 different thermoplastic masks for the treatment of brain and head and neck tumors. Radiotherapy and Oncology, 58, 155-162. https://doi.org/10.1016/S0167-8140 left parenthesis 00 right parenthesis 00272-7. Kahn, F.M., and Gibbons, J.P., 2014. Kahn's The Physics of Radiation Therapy, 5th ed. Lippincott Williams and Wilkins. Timmerman, R.D., and Singh, L., eds. 2012, Image-Guided and Adaptive Radiation Therapy. Lippincott Williams and Wilkins. Unkelbach, J., Bortfeld, T., Martin, B.C., and Sukup, M., 2009. Reducing the sensitivity of IMPT treatment plans to set up errors and range uncertainties via probabilistic treatment. Planning. Medical Physics, 36, 149-163. https://doi.org/10.1118/1.3021139. Van der Voort van Zyp, N.C., Prevost, J.B., van der Holt, B., Holt, B., van Claveren, R.J. Patinama, P.M., Levendog, P.C., and Newtons, J.J., 2010. Quality of Life After Stereotactic Radiotherapy for Stage I Non-Small Cell Lung Cancer. International Journal of Radiation Oncology, Biology, Physics, 77, 1, 31-37. https://doi.org/10.1016/j.ijrob.2009.04.080. Verhey, L.J., and Unkelbach, J., 2013. Proton Therapy, Clinical Aspects and Dosimetric Considerations. In E.B. Podgorczyk, ed., Radiation Oncology Physics, A Handbook for Teachers and Students, 2nd ed., pages 511-558. International Atomic Energy Agency. Willoughby, T., Lehman, J., Bencomo, J.A., Yanni, S.K., Sant Anam, L., Sethi, A., Solberg, T. D., Wessels, B.W., and Yenis, K.M., 2012. Quality Assurance for Non-Radiographic Radiotherapy Localization and Positioning Systems, Report of Task Group 147. Medical Physics, 39, 4, 1728-1747. https://doi.org/10.1118/1.3681967.